The knowledge base of what we do in medicine needs to have advanced to the point where you understand what a cell secretes, how cells communicate, and what growth factors are, and what an exosome is, and the different types of things. The medical industry as a whole, and in particular, I think big pharma, realized very early on that cell therapy was the way the human body works, and they had to get ahead of the narrative before the science of using your cells to help you heal got kind of out of control. All right, so the question is one stem cell therapy enough? So I will tell you, it's a very individualized answer, right? Because it depends on what are you using it for. Number one, do I think that is one stem cell therapy enough if you're starting with zero cartilage in your knee? I'm going to get stem cells in my knee and, it didn't work. Look, I'll tell you exactly what I tell a patient. If you're starting at 0 and want to be 10, there's going to be some work involved. Most people don't need all the cartilage in their knee that they had when they were a kid to not hurt anymore. It depends on how long you've been hurting. So the answer is one stem cell treatment enough really comes down to what's the problem we're treating, what's the area of your body we're trying to affect, and who's the patient. Are you an 80-year-old diabetic smoker? Are you a 19-year-old athlete with a partial thickness tear of a rotator cuff? Are we treating a soft tissue? Are we treating cartilage? Are we treating muscle, tendon, bone? Is it hair loss? Is it sexual wellness? Is it microneedling of your face? Is it a scar that you're microneedling with cells? I think that every treatment is very individualized, and I think for the most part, a lot of what we do is one and done. Interdiscal injections is one. We've done hundreds, and at this point, over 700 intervertebral disc injections with bone marrow aspirate concentrate, which is referred to as a stem cell, so an autologous stem cell from you. And out of the last 6 years, going through our data, we've redone 3 discs. One was an ultramarathoner who runs 100-mile races, had done really well after an annular tear with almost disabling back pain where he couldn't train for over 3 years. The world opened back up. There was a big race coming up in Paris. He wanted to make sure he could go, and he was starting to have some prodromal pain again. He almost had to hold my head underwater to get me to do the disc again because even on the, so we agreed to do the MRI. On MRI, he did have a little bit of increased signal within that disc again. Had been training because he had like a 6-month window that he needed to be better. And even though he could still train, he was worried he was going to get worse because this is how it happened before. We redid him. The other patient that we've redone was an over 70-year-old female that had a big fall and had re-injured her low back. And actually, the annular tear that we had treated before and the amount of back pain that she had at 4-5 was a little different because the disc below was much more involved after her injury. And we ended up treating the 4-5 and the 5-1 disc. And the other patient was me. And we had done me years ago, and then we did me again, I think, in 2010, and we did me again in 2018. So as far as that area of the spine, I would tell you that a ton of those patients, if it's an annular tear and you're having discogenic type pain, leg and hip pain, and it's not just associated with the lumbar stenotic component, a lot of those patients have been one and done. And we fully expect to see dramatic changes in healing with the annular tear injections. If someone's main symptom just on the back is mostly leg and hip pain and they have bad lumbar stenosis and neurogenic claudication, when you inject the epidural space for those, it's more of the inflammatory component that we're addressing and the sticky inflammatory component of the nerve stretch. Those patients do well for 9 months to 24 months. And then some of those neurogenic claudication symptoms can kind of come back. In me, it was 8 years for it to come back, and it's been 6 years since the last one. And I'm dramatically better. But I think, and that's usually the patient's outcome too. We do have an over 85-year-old gentleman who's been a patient for a really long time, who gets an epidural about once a year because it makes a dramatic difference in his stenosis. And he was told at 2 of the leading medical centers in the world that he went to find out what his options were surgically, that they didn't think he would live through the surgery, but he needed some 8-level decompression rods. And so his question was, rightfully so, well, do you have something you think I would live through? And they said, well, we think this is all we have. So he chose to not have that done. And we did an epidural with just cells and with the marrow aspirate concentrate. We have to be careful how we say this because it's social media. But he's done remarkably well for about a year and a half at a time. And it's been a really easy procedure to repeat on him, and he's done extremely well. If it's hair, do I think hair is one and done? No, I think it's best case for the best result because we use a combination of peptide and cell therapy. It's a series of 3 injections. One big stem cell injection, the bone marrow aspirate, the first time, and then we follow that up with PRP and peptide therapy. But it's 3 injections over a period of about 4 weeks apart. So face, do I think that microneedling your face is a one-time treatment with cellular therapy? Well, it can be if that's the result you want. But from an aging standpoint, how long is it going to take for you to continue? But what happens with stem cell therapy is not, if we're talking about an Achilles tendon, like is it one and done? If you have partial thickness changes with one bone marrow aspirate concentrate, most people obtain pain-free range of motion and go back to their previous level of activity. Can you injure it again? Well, of course. Is it some big series of we're going to treat you 3 times to see if we get that result? No. So for certain musculoskeletal injuries, partial thickness rotator cuff, changes like that, usually the cell therapy, the injection process is one. But again, it depends on the patient we're operating on. It depends on the body part we're addressing. It depends on your overall health and your overall result. I'll tell you as an orthopedic surgeon, it's not common for me to get someone better and then come back and say, hey, I want another knee scope because I did so well with that first one and I'm still doing great, but I want you to scope my knee again. That just doesn't happen. On the regenerative medicine side, with marrow aspirate concentrate, when someone says, oh my gosh, you did my hair, we did my face, or we did the sexual wellness part, or we injected my shoulder and knees, and I'm doing so great. Can we do it again? Like, how long do I need to wait? Because they got some better, but everyone wants to be, they want to turn back the clock. If that's your goal, do I think I'm going to do that for someone with one treatment? Probably not. Am I going to be able to get a significant difference with one treatment is a different question. And that's all. The answer is it's never going to hurt anyone, and it's always going to make some difference. Is it enough of a difference for you to not need any more treatment? I don't know. But I know that it's not. I never promise you that with a traditional medical treatment either. No one's going to tell you, oh, we're going to put this one medicine at the starting dose and all your blood pressure problems are going to go away. That's not how it works. If you don't get the result, we increase your doses or we change meds. It's the same way with cell therapy. We're going to anticipate giving you the best product and the best treatment modality in the best way possible and expect it to make a dramatic difference for you. Then based on your results, depends on what we do next. So when the question is at one time, the answer is for the most part, yeah. If even with cartilage in the knee, all I need to do is get you before you started hurting. If it was only in the last year with your arthritis and bone-on-bone pain, I promise you, your knee did not become bone-on-bone in 1 year. It's been bad for a long time, and just over the last year, it started hurting more. Then, yeah, I should be able to get the hands of time turned back enough from an inflammatory load to get you where you were before that.